Hey guys, Dr. Heimlich here, and today we're going to be talking about having low thyroid symptoms but not being diagnosed. I just had another patient come in, which is all too common, and tell me that, hey, I've been going to my doctor for years and asking them to check out my thyroid levels. She's 70 years old. Her doctor told her that, I don't think you have a thyroid problem. I think it's just the old age is why you're having these type of symptoms going on. You know the symptoms I'm talking about: dry, brittle hair, dry skin, hair falling out, constipation, trouble losing extra pounds, trouble losing weight at all, no matter how little you eat and how much you exercise, fatigue, brain fog, and the list goes on and on. But anyway, she had to go to alternative healthcare practitioner to get her diagnosis. And why is that? Well, if the doctor does, a lot of times, check for your thyroid to see if it's out of whack or having a problem, they usually run what's called a TSH. Thyroid stimulating hormone is what it counts, is what it stands for. And that's got a kind of a wide range. So if you don't fall within if you fall within this wide range, you're considered, hey, you don't have a thyroid type of a problem. Now, functionally, it's a lot narrower range, because what happens is when you go to labs and stuff, they take all the people who've come in and had, their thyroid TSH tested, they put it onto a big bell curve, they lop off the ends, and then they consider what's inside what's normal. That may not be what's normal for you. So we can't always trust those blood tests as far as the TSH. There's also over 6 different ways that your thyroid can have a thyroid problem, a disorder. The number one reason for that, as you've heard me talk about before, is called Hashimoto's thyroiditis. Sounds Japanese because the person who came up with it was a Japanese physician. At any rate, that's where the body attacks itself and attacks the thyroid, so the thyroid's not able to produce enough hormone. But if you don't get tested for those thyroid antibodies, then you're probably not going to be able to find that out. So as opposed to just having your TSH done, you should have full thyroid panel done, checking your T3s, your T4s, reverse T3, and a few other things. Checking out your other blood chemistry, checking out your lipids, checking out your CBC, because we want to take a look. Hey, what's the blood sugar doing? What's your adrenals been doing? How about, are you having an indication of a B12 anemia, pernicious anemia? Are you having other types of anemias going on? What's happening with your vitamin D? Because it's pretty much everything that goes on in the body has to do with your thyroid, meaning that everything is related to everything else in the body. So you have to take a look at those other systems, because if you have a dysfunction in one of those systems, like your blood sugar dysregulation, you can have some dysregulation going on with your thyroid. Here's another thing. You actually have to sit down with a doctor and have the doctor listen to you, so that way they can get your history and hear what you're saying to them. So that way they know, hey, here's what's going on with my patient sitting here in front of me. And then you need to do an examination to see, hey, let's correlate what this patient is telling me, what's going on with her blood work, and then we're going to correlate that with what I'm physically finding on her body. So there's a lot of different things that need to be done other than just running your TSH. So the main reason that most people go undiagnosed is just because they don't have a thorough enough examination or blood work, or have someone who is used to doing those type of things and will sit down and listen to them and take the time that's necessary to figure out what's going on with the body. So if you're suffering, or you know someone who's suffering with the low thyroid symptoms, or you've been diagnosed with Hashimoto's or any other thyroid type of disorder, then you owe it to them or yourself to go get yourself checked out by a doctor that understands what we've talked about, because there's a lot of help out there for you. I'm Dr. Heimlich. Thanks for listening.